Trey Kwan with Left Voice at Kingsbrook Jewish Medical Center in East New York, Brooklyn, New York. We're at an action organized by rank and file nurses here, part of the National Healthcare Day of Action, where the common theme is the system is broken and PPE over profit. The nurses here have seen already their coworkers die due to exposure to COVID-19, unsafe working conditions, not having the correct PPE. There are nurses here today who came in ponchos and are saying they do have to wear whatever they can bring from home, whatever their neighbors are donating to them. Some folks are bringing N95 masks because they're not guaranteed those masks.
We need more PPE. The government is saying there's enough, but we obviously do not. We are reusing gowns, we are reusing PPE, and that is not the proper way to use isolation protocols. And they are forcing us to become the vectors for this virus, spreading it throughout the hospital, throughout our patients. We're losing staff to sickness and death. We're losing doctors, we're losing nurses, we're losing clerks.
One gown for the shift, how could that be? 12-hour shift, 8 hours. It's not even good for it. There shouldn't be a time on a gown, because each patient for infection control, you do a patient and you shouldn't even leave the room with that gown. That gown is supposed to use just for whatever you went into that room for at that particular time. And now we have to come out of that room, so it doesn't matter what that patient have, you're carrying that along with you wherever you go.
But with gowns, it's the most important thing, because the gowns, they touch everything. You go into the room, and we have to save those gowns for the day. It's a little bit crazy to save a gown where we're touching things. And I brought Lysol to try to spray the gowns, but that can only do so much also. And then I'm wearing a raincoat that my colleague bought, so we collectively bought. So we bought a raincoat. This is on top just because there's no more Lysol spray, so at least an added layer of protection. So we don't want to bring stuff home. We have families, and it's a little bit, for lack of a better word, just difficult. Everything is just difficult in this situation. And
because this is a really mostly black Hispanic neighborhood, and most of them is getting sick. We already have a doctor die. We have a security guard die. We have a lot of patients is dying that was here before all of this started. So it's bad. We need more PPE, and we need more workers too, because sometimes most of the workers are getting sick, so we are always short. Sometimes we're so short-staffed and it's not good to be short-staffed, because then you have so much to do, and then you get sick just the same.
Friday.
That's what we're doing.
Our co-workers have plastic garbage bags to do patient care. Plastic garbage bags. You hear me? Unbelievable.
I'm here today to support my other healthcare workers and all essential workers who are suffering in this pandemic. If we don't stop safety violations in these big companies like USPS, Amazon, we're not going to stop having patients. We're not going to stop getting sick. We need to support these people too.
It's important to note that in this coronavirus pandemic, that black and brown people have been predominantly affected by it. They're being more diagnosed and they're dying more rapidly than anybody else. That just speaks to the underlying racist nature that our society was founded on, and the underlying racism that's embedded in our healthcare system, that's embedded at the core of the healthcare system. And we're only seeing coronavirus act as a magnifying glass on those disparities that already existed. Our healthcare system has always been in the United States based on extracting profit from sick bodies. It's been based on putting profit over health at its core. What we really need is at the very floor, we need a Medicare for all system, a national improved Medicare for all system, but that is the floor. What we actually need is we need to nationalize healthcare. We need to nationalize all of the industries that have to do with health. So that means pharmaceutical industries, that means device manufacturers. They all need to be nationalized, and they need to be put under democratic worker control. The workers know what's needed, and the workers know how to run these systems themselves. We don't need executives there at the top acting as parasites to just get large salaries. Workers know what they need. The workers and the patients and communities can run these hospitals and these industries for themselves.
People up there and high up there, and Donald Trump and everybody else is high up there